I think the reality of where we are right now is that everyone is directly or indirectly affected by issues of well-being and mental health. Whether that's you specifically or whether that's people that are close to you, you're never far away from a discussion along well-being and mental health lines.
When leaders show vulnerability, they're giving permission for people to share their concerns. If they're upset about something, it's okay to go and talk to somebody about it.
I was incredibly lucky to be hired by HSBC 6 months after I had spent 2 months in a psychiatric hospital. That, without any doubt at all, saved, transformed my career, and I think it has been a pivotal moment in my life and the life of my family.
I think for me the biggest thing has been recognising and understanding that we all have mental health in the same way that we have physical health, and it allows us to go out to our colleagues, to go out to our teams and say this isn't something that we're just paying lip service to, this is something we truly believe in and that we've bought into.
But talking about mental health openly can be very scary initially, but it does really empower others to feel able to do the same.
My hope would be that people recognise when they are becoming unwell. I think we have a duty to continue to educate people and share stories and make sure that, through whatever medium it is, if it can't be face to face, that we're talking and supporting people who maybe aren't dealing as well as they could be.
So mental health means to me creating a space where I can speak about how I'm feeling, about the ups and downs that you feel within your day, and having just a safe space that I can communicate that. I think for me, when I can't communicate it to colleagues or to friends and family, I think that always makes everything worse and always makes everything spiral.
Being part of CMHA has really helped make our discussions around mental health more credible. Quite often misconstrued that mental health can lead to underperformance, but it just allowed people to see that nobody is immune to this kind of issue.
And it's been really fantastic to see CMHA going from strength to strength with great growing membership over the years, producing great thought leadership through guides, assessment, and the support around the thriving at work standards, and very importantly, bringing mental health conversations to the boardroom and also more recently with regulators.
We have got people of every different ethnicity, every gender, every level of seniority or juniority within organisations talking about their mental health with pride. We're educating people and we're creating a community that is a really single, strong, amplified voice saying mental health has to have a strong place in the workplace.
One passionate person can make a difference, but actually more structural support. I value that expertise that I can draw on through the Alliance.
So that wellbeing agenda, how we shape that, the work that we do with partners like City Mental Health Alliance is really, really important. And actually, what I really like about City Mental Health Alliance is that it's a great opportunity to meet businesses very similar to ourselves.
For myself, as the country head, it has helped me in looking across, getting some inspiration from what other leaders are doing, having the ability to connect with them, exchange views. I think that is really part of what I think makes us constantly improve the way we do things.
Particularly when you have something like a pandemic and you realise how much focus there needs to be on mental health and supporting people. If you are not doing that, you're going to have serious issues with the health and well-being of people who work for you, and they won't want to stay with you because they'll want to work for organisations that do understand it and do provide proper support. And we absolutely have to do that.
So from a personal point of view, anything that can be done to make the difficult first conversation to reach out for help, anything that the City Mental Health can do to to initiate that or to create an environment where that type of discussion or similar discussions can take place. It's critical, and as you can tell, it's certainly very personal for me.
We're on a journey, and I don't know where that journey is going to take us. I need other organisations within the Alliance to help us on that journey.
So every piece of work that we do is co-created, it's collaborative, and the best thing about every piece of work we do is that people that are, or organisations and companies that are competing in the market are working in a room together, doing this together. And that, I think, is the power of our community.